Let's go ahead and get started. Good evening, everybody. Welcome. I'd like to thank everyone for listening and taking time to join us tonight. We are recording this, and so it will be posted as well. My name's Erica Nelson, and I'm the co-president of the League of Women Voters of Glen Ellen. And tonight I'm joined by Mike Murray from the Bloomingdale Township Mental Health Auxiliary. Our roles tonight will be as moderators. Milton Township will have an opportunity this April on the 6th to pass a referendum to start a community mental health board. And tonight we are dealing with the subject of developmental and intellectual disabilities. This program is the third of 4 programs on how mental health boards could work in the Milton community. We're going to hear from 3 accomplished professionals. Mike, anything you want to add?
Yes, Erica, I do have a few comments. I'd like to remind the Milton Township citizens that the over 8708 boards in Illinois fund critical services for children and adults with intellectual and other types of developmental disabilities, as well as mental health services and substance abuse treatments. However, what's truly unique about 708 boards is that 100% of the funds remain local, and that local focus provides much needed funding, among other things, for expanding early intervention. And of course, early intervention leads to reduced costs later on. Communities, from my experience talking with boards around the state, reduce or eliminate gaps in services, and there are a lot of those for a whole lot of complex reasons. But above all else, for me, when you're in crisis, there is nothing more effective and comforting than a local response. I know I always prefer dealing locally whenever possible, but we have 3 people tonight, Erica, who have dedicated their lives to service, and I can't wait to learn from their experiences. Would you kindly introduce our first speaker?
Yes, thanks so much. I'd be happy to. I want to mention briefly that if you have a question tonight, the Q&A is available, keeping it open so that if there are questions that can be answered during the content time, we won't wait till the end of the session to do that. So please put them in Q&A, and we'll do our best to answer as many questions as possible. Our first speaker tonight is Teresa Forthofer. Teresa is President and Chief Executive Officer of Easter Seals DuPage and the Fox Valley region. Teresa is not only a 30-year professional, but also a mother to 2 sons with disabilities. Teresa, welcome.
Welcome.
Glad to have you here.
Thank you. I appreciate it. I know our parent is trying to get in, so if you could take a look at that, I'd appreciate it.
Yes, we'll keep an eye on it and move her over as soon as she's here.
Thank you. And my name is Teresa, and as Erica said, I'm the President and CEO at Easter Seals DuPage and Fox Valley, and we provide expert multidisciplinary pediatric services for more than 3,000 infants, children, and adults with mild developmental delays to complex disabilities or medically complex disabilities. We serve children from the infancy until young adulthood. What sets us apart is that we are the only CARF accredited rehabilitation center in this part of the state. There are 2 in the entire state. We're an NDT center of excellence as well. We're a teaching facility. We have EI, early intervention, credentialed therapists. That's for children 0 to 3. And we're also multidisciplinary. So we have a variety of therapists and disciplines that we have professional and experienced trained therapists. We have expertise in developmental impairments such as autism and several others, genetic impairments, neurological impairments, orthopedic impairments, trauma and injury, including brain injury, and conditions requiring nutrition and feeding interventions. We have a variety of, we treat over 200 types of disabilities and developmental delays, again, from very mild to medically complex. So I wanted to share some facts and figures. So 17% of Illinois children start school with a disability or a developmental delay, and 25% of our kids starting school have an unidentified disability. The total spending to provide this combination of regular and special education services to students is very expensive, $77.3 billion, or on average 12,474 per student. But we know that by addressing developmental delays early in a child's life and intervening and being able to provide those therapeutic services while their brain is developing, we can actually save and reduce the expensive intensive school-based approach. According to the CDC, disability costs and healthcare expenditures are 16 billion per year in Illinois. And well-designed early childhood interventions have been found to generate a return on society ranging from $1.80 to $17 for each dollar spent. And I think, that gives you a perspective of the state and but what I want to talk about now is how it's impacted specifically in Milton County. So according to the US Census, there are more than 30,000 children living in Milton County. And we know that 37.5% of residents live below the poverty level, and 5.5% of residents live below 50% of the poverty level. So that's a huge number. And the CDC also reports that the average rate of disability among children is 17.8%. So if you take all of that data and you look at Milton County's children, there are 5,340 children living in Milton County with a developmental delay or disability, and 2,296 that live in poverty. And in Easter Seals, we are the largest, most comprehensive rehabilitative provider for children. And we serve 190 of those 2,296 kids. That means there's a lot of children who aren't being served. 54% of the children we serve are under the age of 5. We know the importance of early intervention for children and how it changes the brain development. And so we need to really think about how are we going to serve those communities.
So AID has been around since 1961. We have the same origin story as many people, including Ray Graham, except for I think they were a little bit earlier than us, is that we had a group of parents who had children with disabilities who, before the Special Education Act, had nowhere to go and no support for their children. And so people came together in communities that were aware of each other and created a lot of not-for-profits around Illinois and around the western suburban region here where we work. We have started out like that. Once the Special Education Act passed, we were able to then pass that school on to the Aurora School District, and had already started some additional services in the early 80s. We also became a community mental health center, and we work with persons, about 5,600 children and adults, mostly adults, across about a 7-county area in the last fiscal year. Our mission is to empower people with physical, developmental, intellectual, and mental health challenges to enjoy lives of dignity and purpose. Our main service areas are listed there. We're also in DeKalb, a bit of northern Cook, and a little bit of Will County, because just like Naperville, Aurora is in 4 different counties. So it makes things interesting. Next slide, please. So we have a long history at AID of partnering with community mental health boards. And because we are in a variety of locations, there are several different types that we partner with. We have county-wide boards in Kendall, DeKalb, and McHenry counties. So all of the funds that are raised are within an entire county and are able to be dispersed across the county. We also work with city-sponsored boards in Geneva and St. Charles, which are in central Kane County. And then in southern Kane County, there is a community mental health funding alliance, which is made up of 7 townships in southern Kane. And so they pool their money together and have people that sit on their 708 board from all of the various townships that are listed here: Aurora, Batavia, Big Rock, Blackberry, Caneville, Sugar Grove, and Virgil townships, in order to grant funding towards services. Just recently in Kane County, Elgin Township and Dundee Townships approved 708 referendums, and those boards have been meeting and putting together their plan, and will be putting out a RFP for their first granting cycle soon. Yeah, so it's very exciting. They both have elected, I believe, to levy the rate at the highest amount that's allowable. All of these boards are very important because they help provide funding for services that can't be billed to Medicaid. So as Teresa spoke earlier about the deficits in funding in terms of paying for what a service truly costs, Medicaid does not pay for what it really costs to deliver a service. And there are many services that are not Medicaid allowable, depending upon whether a person is using Medicaid waiver services or state plan services, and what is approved within those packages in Illinois. So at AID, we have a variety of services that we receive funding from 708 boards for. So some dietitian services, some nursing services that are above and beyond the small amount that we get for nursing within our DD waiver services, psychiatric support. As Teresa mentioned, psychiatrists can get about $250 or $300 an hour, and the state rate pays about half of that. So it's very difficult to get psychiatric access, even harder to get it for people with a dual diagnosis of developmental disability and a mental health diagnosis. We also run at AID a crisis phone line and a text line that anyone in the Fox Valley area, and actually we get calls from all over the place, can call. And that's a totally unbillable service, right? Because if someone's in crisis and calling you upset, distraught, looking for services, trying to figure something out, you're not going to ask them, okay, what's your insurance and what's the number and what's your name and all that. And so that's been very helpful in order to offer that level of support to people. We are able then to answer victim services and other crisis situations in the community through that crisis phone and text line. The other way that we have requested 708 funds and partnered with our 708 boards is funding for people who don't receive Medicaid. So we still have people that are not eligible for Medicaid, often persons that are undocumented or for some other reason are ineligible for Medicaid, still have disabilities and health needs. So we often are able to fund people that way. And in the DD system, we have long waiting lists for people to receive even Medicaid funded services. And so we have supported some groups of people in accessing our community day services or employment services or other pieces through 708 board partnerships that pay for people in their township who are unable or have no insurance in order to be able to pay for that service. The other thing that 708 boards are good for is being able to pay for innovative practices and ideas that we need to try out in the community in order to get them someday to be Medicaid eligible, right? So you have to prove that something works and you have to have funding to be able to try things out. For example, many services in a more modernized version of housing where people have their own apartments and access to services and supports in order to live there isn't necessarily paid for within our Medicaid waiver for intellectual and developmental disability services. So being able to receive funding that is more flexible and able to serve the person in the way that they wish to be served in their community are very beneficial to have through partnerships with 708 boards.
Right. Kim, we're hoping you can speak to how Illinois compares with other states when it comes to serving people with developmental and intellectual disabilities. And I'm sure that COVID-19 and this pandemic has affected the developmental disability community. Can you please share how you've adapted and any potential, long-term implications of this public health crisis?
Thanks, Erica. Thanks everybody for being here tonight. For those of you who don't know, Ray Graham Association has been around since 1950. And since we mentioned the Special Education Act, I will just mention that Ray Graham was actually the first director of special education in the state of Illinois. And at some point, we adopted his name because he was quite the pioneer in terms of ensuring that our young people with disabilities in schools, or at that time not in schools, had the right to a full and complete education. Every year we serve around 2,000 children and adults. Our services fall into 5 primary areas. Residential, meaning a variety of residences, apartments, single family homes, where support is customized, whether it be a few hours a week or 24/7. Recreation services, which includes a whole host of, Special Olympic activities to therapeutic horseback riding services and lessons at our Hansen Center. We also provide a variety of services that focus on life skills development. That comes in all different shapes and sizes, that really focuses on functional life skills and supporting people to learn how to use their community so that they can become full community members, just like everybody else wants to be. We do a great amount of work in the area of employment, helping people to become gainfully employed in their community is one of the most important things that we do. When someone asks you, Erica and Mike, what do you do? They're not asking you, what do you do on a Wednesday night at 7 o'clock? What do you do means, what's your occupation? What's your career? And we want everyone that we support to be able to proudly say what their career or occupation is. Not only does it give you money in your pocket, but it also gives you a great deal of satisfaction and self-esteem. We also focus on supporting families to stay together. And that is, you mentioned the pandemic, and I'll talk about this in a minute, but that has turned into an enormous amount of focus over this past year with the extra stress that's been added to families. Every day we focus on our mission, and that's to create opportunities that empower people with disabilities to reach, grow, and achieve. So how does Illinois compare to other states? Lori mentioned that if you read the newspaper, and don't even have to dig too deep into the words, that Illinois has a horrible financial position. However, that did not happen overnight, and it did not happen as a result of the pandemic. It did not happen because of one party or the other party politically. Illinois used to be a well-respected state 15 or so years ago. We were among the first states to move forward with integrated supported employment for people. We were already moving to smaller integrated homes when the rest of the states around our country were not. But at some point, the spigot literally shut off. Community providers like ours went a decade without one single cost of doing business increase, not one. In that same time period, if my memory serves, inflation went up 18%. So we just plummeted in terms of a system. And sadly, people with disabilities and their families are the ones paying the price. So when you compare us against all other states in the country, we rank 47th in 3 areas. 47th in terms of our fiscal effort towards community services, which are the set of services that all 3 of our organizations have talked about providing. We rank 47th in funding that promotes inclusion. We also rank 47th in how we fund for services that lead to employment. Lori talked about the number of people waiting, and in Illinois that's called the PUNS list, but it's not even really a waiting list, it's really an unserved list. Because if you go to your physician's office, you come at your time, you sign in, everyone, it goes in order. In Illinois, that's not how it works. So you have people waiting for maybe a couple of years, people waiting up to 8 to 10 years to get services. Now, we've made a little progress, and it's only because of the class action lawsuits that Lori mentioned. However, the latest data still says that we rank 5th highest in terms of the number of people waiting for services when compared to other states. What that translates to is 18,452 people in this state are waiting for services and need services. And as you drill that down a little bit farther, that data says that there's 719 Milton Township residents that are registered on that waiting list, and 314 are saying that they need some sort of immediate service today, right now, that's not available to them.
Kim, can I interrupt you for a minute? Give us an example of a service. I know that I've shared some of these statistics that I received from you when we've been speaking at some of our public meetings. What's an example of a service?
So an example of a service could be the need for the family member with a disability to move out of the family home. Maybe it's because the caregivers are elder and unable to care for their family member anymore. So they need a residential setting, which what we refer to as a community integrated residential living arrangement here in Illinois, which essentially is a small group home where people live together with groups of about 4 or 5 people, and they have staff with them around the clock to help them to live as independently as possible. Another service might be the need for what we refer to as home-based services, which means that families want to keep their family member at home, but they need help in their home. They need a personal support worker to come and help to care for their family member, or to take their family member out to learn important life skills. Another example is what is also referred to as community day services. Many of us offer Monday through Friday during typical work hours, structured day activities that can be related to employment, vocational training, life skills development, et cetera, that are center-based or embedded in the community, that provides that structured learning and also provides respite or relief to those families during those daytime hours, so that family moms and dads can work, or just get a little break, because the stress that's involved in a home where there's 1 or 2, and I will stress that sometimes we serve multiple family members in a home that has disabilities. So those are just a few
Thank you.
examples.
Yeah, those are great. Thank you for clarifying.
So COVID-19, first of all, it is simply amazing to me that it has been almost a year to the exact date that we were ordered to stay at home here in Illinois. When that happened, not just services at Ray Graham, but services around the state were shut down. And all resources that, at least at Ray Graham, and I think I can speak for AID as well, and Teresa, Easter Seals is slightly different because they don't offer residential services, but all of our resources immediately shifted to ensure that people that live with us 24/7 were healthy and safe. Our team members worked around the clock. Many of our team members actually left their own family homes, left their children with their spouse, and moved in to our homes so that we could limit the exposure of the virus and be able to focus on people's healthcare needs that were an immediate need for us. What also happened was that those day centers shut down. Many people lost their jobs who were gainfully employed in the community, or if they were living with 3 or 4 other people who had very high medical needs, sometimes we had to ask them to step away from their employment to keep everybody else safe in their home, especially if they worked maybe in a grocery store or somewhere with the public. When those services shut down, and there was no place for people to go that would typically come to us, let's just say Monday through Friday, from 8:30 to 3, all of those folks started staying home with their families. And just that change of routine, for many people is devastating. Also, with our services shut down, that also meant that mom or dad or both couldn't work. So we started to see that increase of needs in the family home. What was really very, very concerning and still concerning today is that many of the people that we support, children and adults, have underlying health conditions. So even though we know little about this virus, studies that have been conducted so far tell us that the mortality rate is 3 times greater for people who have intellectual and or other types of developmental disabilities. Much of that is because of the underlying health conditions, but also we serve a population that doesn't understand social distancing, is unable, and I'm saying really unable to because of to wear a mask. They don't understand it, and B, they can't tolerate it. Sadly, what we are finding ourselves dealing with when it comes to people, and it's just like the general population, is social isolation that's trending towards more depression. And we're really concerned about people losing everyday life skills that they were using pre-pandemic that they haven't been using for a year because they've basically been homebound. You know, we're all talking about defining our new normal, and that's what families are trying to do too. And I think that it's a perfect opportunity for a 708 board in Milton Township to step in and to help this already, you know, wounded system be able to meet the needs of your community members.
Thank you so much for all you do, for the care and the dedication and the commitment and the sense of humor and the love that you bring to your work. We couldn't be more grateful to you as community members for all that you do. And thank you for being here tonight with us.
Thanks for having us.
Thank
Thank
you.
you.